Good morning. We're living in challenging times. But during challenging times, the people of Kern County rise up and respond and do what is needed. During this time, as so much focus is rightfully on the COVID virus, there are other great needs in our community. And currently, we have a shortage of blood. We're 80% down in donations, and we're calling upon the people of Kern County to do what the people of Kern County always do, respond. So I am here at Houchin Blood Bank, united with others who are prepared to give, with our CEO here, but I am calling upon Kern County to respond in giving. People live when people in Kern County give. Let's think about our families who are cancer patients, mothers in delivery rooms. They all need blood during this time. Indeed, people live in Kern County, families live in Kern County when people in Kern County give. Dr. Bryan.
Thank you, Mayor. I can't say it as eloquently as the Mayor said, but the number of cancer patients, trauma patients, burn patients, those don't change even when coronavirus comes in and affects our communities. The rush for toilet paper, for food, those are things that we see acutely. What we don't see is that in the hospitals, the same patients are there that are there last month and that will be there next month. And I'm asking you, as a member of this community, to continue donating blood. It's an imperative that we continue to donate blood. Our numbers are down because of so many blood drive cancellations. We still have our donor centers both at Truxton and Bolthouse, and I would encourage you, as a member of this community, as a leader of this organization, to please come in, donate blood, save lives, be a hero. Thank you.
Brett, have you seen a downturn in numbers of people coming in since the virus?
Absolutely. We've seen a huge downturn in the number of people coming in since the virus was announced and a lot of the measures have been put into place. That number is somewhere between 50 to 80% decrease in donations per day. And the reason for that is mobile drives. Our mobile blood drives have been canceled. Now we still have some. I'll let Susan over here come and tell you the blood drives that we do have that people can go to. Susan, would you like to tell them?
Sure. We do have a couple of drives that are scheduled. So for the people that live in the northeast side of town, they're a little bit of a distance away from our donor centers. We do have a blood drive tomorrow at Foods Co. on Haley Street. We're also going to be at the Target East Hills store on Thursday. And then for the people on the northwest side of town, we're going to be at the Bridge Bible Church on Friday.
Is there a way for people to let you know they're coming?
Yes, absolutely. They can go to our website at hcbb.com and they can look for the drive that they want to attend, click on that, and they can sign up online.
Could I get your name and title, please?
Sure. Susan Bowser, Director of Community Relations.
How can we as a community ensure the public that it is still safe to go to these blood drives and donate blood as well?
Well, as a blood donation center, we're required to maintain levels of sterility and many protocols that keep everything safe. You have to know, we clean down the counters, we have hand sanitizer, all the beds are cleaned off. It's a very sterile environment. There's no risk of contracting coronavirus from the blood donation process itself, and there's no risk of contracting coronavirus from the transfusion of from healthy donors.
What message do you have for people who have been made really consistent in making sure that they do show up and show up right now when they are in the most need? The consistent donors should come in.
Yeah, if you're feeling ill, don't come in. If you're feeling well, bring a friend. That's what we've been saying. And so we need as many people as possible. Our consistent donors that come in every couple of months and that we see them, we know their names. We need the people who have come in just one time in the last year or a few years to come in to donate blood, because right now is when we need you to step up, and it's a critical need.
You mentioned healthy donors. Are you guys asking extra questions during the screening to make sure they're healthy donors?
We are asking questions, as we always do, to make sure that everyone is a healthy donor. It's actually part of our FDA mandate. We do everything from vitals to checks to make sure that they're healthy. And so we will always, whether the coronavirus is here or not, we'll always make sure that the people who donate are healthy.
There's this 15-day incubation period, so is it possible, or do you have checks in place for somebody who may, let's say they're not showing symptoms, they're not feeling symptoms, they don't even have a clue that they might have it, but it may turn up later that they did have something? Do you have a way of checking into that?
So currently we have deferrals in place, which means you can't donate blood for a certain number of days. We have 28-day deferrals based on travel restrictions. A lot of those are to different countries. For instance, Asian countries where the coronavirus is said to have originated, and then from several countries in Europe where there was a large outbreak.
Right, we just got our first confirmed case of coronavirus from a non-resident. What measures are the blood bank and also the city going to take with this new information?
Mayor, would you like to answer that from the city standpoint?
The city will continue as we have been doing to take every precaution. We're counting on our health, public health advisors and experts and our doctors and all to give us specific advice. But the city is being proactive. We will continue being proactive and communicative with our public.
Can you say, do you have, oh, I'm sorry.
And I'd like to answer your question from a blood bank perspective. We're in constant communication with the Department of Public Health. There's an emergency operations center that's been stood up at a small level. We're talking with them. We also communicate with our national partners, both at the FDA and our accrediting agencies, and we follow all the guidelines that they've laid out for us. And so many steps are being put in place to ensure that our donors, as well as the transfusion patients, are safe.
I'm sorry, do you have numbers on what the actual blood inventory currently is and what it normally is?
Right, so we are down, particularly with B positive and B negative. We're actually in the negative on our inventory, and we're trying to see if we can bring it in from somewhere else in the nation. That's not a normal thing that we would do, particularly for B positive and B negative. But the rest of the nation is experiencing exactly what we're experiencing. So at some point, we may not be able to bring that in.
Just to clarify, you said that's not a normal thing.
Normally, B positive and B negative are not blood types that we are in extreme demand for. Normally, those are O positive and O negative. I can 100% assure you by the end of this week, every blood type is fair game. Please come in and donate.
You're asking for platelet donations as well?
That is an excellent question. Platelet donations have a 5-day shelf life. And so that means, unlike blood, which can last many, many weeks, platelets only can stay on our shelves, and they have to be transfused into a patient within 5 days. And so we can't hold out very long without platelet donations. We are in extreme need of platelets.
Asking people who are not working right now, students not going to school, to please come and give blood since they have all this free time?
Absolutely. You know, my kids are out of school on Wednesday, and I would say by next week, you're probably going to be climbing the walls. We have play areas, particularly over at our Bolt House Center, a little Nintendo system. Leave them with us. We've got cookies, we've got juice. You go donate blood, it'll give you a breather.
Are there extended hours for that, or is it earlier hours, or?
So our hours right now are from 9 to 6 every day except for Thursday, and that's from 11 to 7. And then we also have Sunday hours, which we're opening up now from, Susan, 9 to 2. And then we've also positioned mobile blood drives in particular areas throughout Bakersfield to increase convenience so that people don't have to drive as far. And those will be announced on our website. Mayor? You have any more questions? Well, thank you guys very much.
Thank you.
If you're interested, we have the CEO of Adventus here, and she's someone who gets a lot of blood from us, so she might have some comments as well.
Yeah. So Charlotte Briggs, President and CEO of Adventist Health. We chose to come here today. We have 3 of our executives. We just have staff there that really need to take care of patients. So the ones that don't have hands on the patients are sent home to work. As you can see, the 3 executives that are sent home to work, we decided to come in today. We heard about the need for blood, so we decided to come today and be part of the people in our community who give back to Houchin Blood Bank, who actually give to our community because our community always gives to us. So we took this opportunity today to show up and be part of the group that is giving blood.
Can you provide names of the
Charlotte, S-H-A-R-L-E-T, Briggs, B-R-I-G-G-S.
And your title again, please.
I say what?
Your title again, please.
President and CEO. So yeah, we would just ask anybody who's sent home, come join us. It's a great call. Thank you.